power that comes through being more digitally enabled is about this engagement piece. It's like we can engage with more people.
Well, cystic fibrosis is a condition that affects 11,000 people across the UK, and we have a register of information on almost all of them, which gives us a very rich data source.
In terms of Parkinson's UK being a digitally mature organisation, we're investing in the things that underpin that. So people change, making people feel digitally confident and capable, and systems change, so we're investing heavily in our data infrastructure.
First of all, we're quite a large organisation in our external footprint, so we're quite mature in some areas that we invest in, whereas quite behind in others.
I think probably some areas, some parts of the charity are very, very immature, and others are much more developed. Like we've got a UX team, we've got a user testing lab like within our office, so like I know that means that we're much further ahead than other charities.
I think we've still got a long way to go in terms of embedding that particular sort of approach with all our supports and care that we deliver, and also just in really the digital skills and capability around the organisation.
Probably about midway there. Maybe before today I'd have said we were slightly further on. We still very much use digital as a form of communication.
I think the biggest impact that we've made at Parkinson's UK in terms of improving our digital maturity has been around developing a culture where people feel like it's okay to try things.
I think the biggest impact, which is actually now 20 years old, is the collecting of patient data routinely through annual reviews. I think one of the things I would emphasise is though that our board and our staff are aware that this isn't a quick fix. Actually, this is a multi-year process.
You can kind of apply for your project to get digital support, and then you get a kind of proposition manager, an agile delivery manager, someone from UX, a producer who can help with, and it doesn't have to be about digital things.
We've done something really small. We've just relaunched our website. We've been able to do that in a relatively short space of time.
We regard the use of data and the use of technology, sometimes under the banner of digital health, but we can all argue about definitions, to be a fundamental role and part of the future for people with cystic fibrosis.
Doing kind of simple things. We have an online community for people with arthritis. People get incredibly down when they have arthritis and they go and talk.
So there are 11 million people with hearing loss, and they all need our support or information at different stages of their hearing loss journey, and we can never meet those needs face to face. So by using digital, we can aspire to reach many, many more than that.
Internally, it's sort of setting a sort of guiding ambition to be more digitally enabled, enhanced, whatever that might mean. So we know that patients want their data to be shared for research and for care. We absolutely know that from all the polling we've done. But we need to win the hearts and minds more broadly of the public.
I think the biggest challenge for Parkinson's UK in moving on in terms of what we want to achieve through technology is actually that understanding piece.
People think that digital is about digital, and it's not necessarily about putting users' needs first, whether that's for something online or whether that's for something that's not online. And I think that there's this just expectation that we're just trying to make everything digital, and that's a bad thing.
I think resources. We're quite a small charity. In terms of the digital team, it's just me, which is just quite frustrating because there's not the time to do everything that you want to do.
We actually have a very supportive environment, but there are still profound challenges in there because there's a lot going on, and actually a really good conversation between the board and the staff team to make sure that we're choosing the right things to target.
I think the two biggest barriers are going to be, firstly, resources, and name me a charity that doesn't have that as its biggest barrier. And I think the second is going to be people related, so skills and culture.
It is culture. So the culture within Wellcome, as may well be the case in other big organizations, is quite siloed between different divisions. So you need to do a lot of engagement between divisions at both senior level, at executive board, but also at middle management.
We have a fantastic data strategy lead, we have a digital product management lead, we have a digital innovation lead, all of whom work with the whole business to change that culture.
Set up quite a lot of spaces, for lack of a better word, for exchange of information. Everything from informal working groups to more formal boards.
I think one of the best discussions we've had at a governance level is being given the right to fail.
So I think what people should be doing more of is collaborating.
I think I would have started the data journey much earlier.
I've been very fortunate that we have the full support of our board in recognising the opportunities that these technologies offers.
sometimes it can take a much longer.
I think discovering that people are actually up for quite a lot of risk in innovation.
I think the single piece of advice that I would give anybody, almost in any organisation, is to look at the world in which we live now.
Just beginning to interconnect systems enables, unlocks all sorts of future innovation. Without doing that as a first step, then other things are just not possible.
Work with the SME sector, work with industry, work with the academic sector, work with government. Don't be kind of blinkered in who you work with.
So the biggest thing at the moment is data. So we're trying to connect quite different data sources that we have within Wellcome.
The next stage really in our journey is kind of to work out where our sort of artificial intelligence project sits within the broader sort of strategy, and also where we want to be in terms of digital health, which we've been talking about today.
So we've worked with an absolutely fantastic consultant who's helped us to put together a top-line strategy and a roadmap for the way that the charity needs to develop.
To see how technology is being used and how it's changing so rapidly, it's unimaginable that you wouldn't enter that space and you wouldn't engage in that.
A lot more innovative work, I think, with external partners.
Whether it's charities coming together to define something collectively in the same space, so don't do it all individually.
I think we've set a 5-year strategy, and over those 5 years we'll need to commit significant investments. And the question is just when and how much and how.
This year for us in terms of our digital transformation is a lot about the transformation of our traditional and existing services. It's not about replacing those people with robots, it's all about creating more capacity.
And actually one of the roles I think that the Cystic Fibrosis Trust plays, in fact all charities in particular conditions play, is to galvanise interest among partners, researchers, clinicians and others to make sure we're having a really good digital conversation, but see it as a tool and see it as part of transforming your ability to deliver the very same objectives that remain constant within your organisation.